Venkatesh, ma'am.
Just 1 minute, madam.
Okay, okay. You let me know, okay?
Yeah, we can start now.
Okay. Good evening, doctors. I'm Dr. Prachi from Shield Healthcare, and many thanks for joining today's webinar. We have eminent speaker today, and ma'am needs no introduction actually. Dr. Pujita Devi is going to speak on menopause management and quality of life. Ma'am is MS Ops and Gynec FMAS and laparoscopic surgeon from KIMS Hospital, Hyderabad. Mom has special interest in high-risk pregnancies, complicated minimal access surgeries, including laparoscopy and hysteroscopy. Mom has published many articles in international journals, presented paper, poster, and oral presentations in national and international conferences. Mom is recipient of many awards, including South India Women Achievers Award in 2020, COVID Warrior Hero Award, and Best Gynecologist Award by High Nine Private Media in 2020. National Award in Services as a Doctor by National North Delhi Cultural Academy in Delhi in 2019. Also, Best Gynecologist Award by International Glory Awards, that is IGA, in 2019, and Best Doctor Award by Friends Association in Hyderabad in 2018. So, with this, may I request Dr. Pujita Devi ma'am on her talk on menopause management and quality of life. Over to you, ma'am. Thank you very much.
Yeah, thank you. A very good evening to all the doctors, and thank you for the great introduction, Prachi. This is Dr. Pujita. So today we are here to discuss few things which are very commonly asked questions by all the women who are reaching menopause. Maybe because of the stress which are being faced by the women, the symptoms, maybe the perimenopausal symptoms are being aggravated day by day. So maybe this will help a few people, women how to go at maybe not only the doctors, where we can have a healthy discussion. It might be a good session for the normal women who are going to face all these problems. Yeah, as I always say in my OP also, we are gifted with lots of things, maybe from normal cycles, maybe the normal periods which are being started, to the mood swings, to the wrinkles, whatever we have. But still, even after the wrinkles, also development of the wrinkles, also we have the menopausal symptoms. So this, we know the definition of the menopause, and this word has been come from the Greek. And usually 730 lakh women in India are in the menopausal age, but only 5% are getting treated. And the average age of the menopause in India is around 49.5. Lesser than, it is usually lesser.
Excuse me, madam, this slide is not visible.
It's not visible. Able to see, sir, now?
Yes, madam. Make it a full screen.
Now, sir? Able to see?
Yeah.
Yes, yes.
Yeah, thanks.
So maybe the average age of menopause in India is around 49.5, and usually it is lesser in the Western countries also. And most of them have more than one symptoms. They not only have not only hot flashes, not only mood swings, they usually have multiple complaints. And when it comes to the prevalence of menopausal symptoms in India, there are lots of variants were there. Almost 47% are suffering with this menopausal symptoms, and in that, vasomotor symptoms will be there, physiological changes which causes lots of pain, so psychosocial causes and sexual disorders, and as well as the quality of life will be bothered because of all these symptoms. So usually there are phases in the menopause also. There is an pre-menopausal stage and after the menopausal. And because we will know exactly what is the definition of the menopause. So in the phases, we usually see the premenopause that is usually occurring prior to the menopause, usually ranges from 2 years to 10 years also. And menopausal phase is an end of the menstruation. Perimenopausal age is like in between this premenopause and the menopausal phase. That is the reason we just kept it in between. So here there will be the end of the reproductive capacity and the terminating the climateric conditions. And when it comes to postmenopausal, there should be an year gap for the menstrual cycles. There should not, any woman should not have any cycles for 1 year, that is 12 months consecutively. Should not have even a single cycle in between also, so that if they have a single cycle in between, they are not considered as a menopausal woman. So usually age of the nowadays, if we see or if we go through the graph which has been going on, age of the menopause is being constant, but the life expectancy of the females is being increasing, which is a good thing. And before going into the menopause, we have to know certain changes like physiological changes has to be known. So this physiological changes, why this menopausal symptoms usually occurs, what are the important hormones which are being affecting this menopause. So there are two hormones like estrogen and progesterone, as you know, which every female is being dependent, and androgens and testosterone, though we'll have in the lesser quantities. But still, as the age increases, the follicles is being decreasing in size from the birth, and the estrogen which is being secreted by the follicles will be decreasing. So it comes to an end stage where there no estrogens will be present in the body, from where the symptoms usually starts. So apart from this estrogen, there are few changes which are being occurring during the menopausal ages. Their circulating estrogens will be decreased, and that estrogen androgen ratio also will be decreased. Sex hormone binding globulin secretions, this is a very important hormone which causes all the changes. And conversion of the DHA, the peripheral aromatization, which usually occurs in the fat, which converts to estrogen, also decreases. And usually estradiol is an active hormone, which is being converted to the inactive, that is estrone. And there will be significant decrease in the testosterone levels also. So usually manifestations will be short-term manifestations and long-term manifestations of the diseases. Short-term manifestations, it might be varying from hot flashes to even Alzheimer's, that is cognitive decline, almost the memory will be lost. This is a very severe complications what we are discussing. And the symptoms of usually menopause are being indexed. There is an index which can be measuring the discomfort symptoms of the menopause. And this index is a numerical conversion index and covers all the above menstrual symptoms. This also varies from vaginal dryness, might be an initial this thing, to severe headaches. So there are estrogen receptors. Usually, why lots of symptoms have been occurring. So we should know where are the important, what are the important organs where the estrogen receptors locate. It usually locates in the brain, breast. If you see, almost all the organs in the body are being covered, from heart to the skin. Even hair is also being dependent upon the estrogens. So when it comes to, let us have a brief discussion about the menopausal symptoms and signs. When it comes to classic symptoms of the menopause, there will be a menstrual changes, vasomotor symptom changes like night sweats, it's called as an hot flashes, and vulvovaginal symptoms. It varies from itching to the dyspareunia, is difficulty in intercourse. And other symptoms which are being associated with menopause, yeah, definitely we'll go into in details later. So when it comes to menstrual changes, it can be a lighter or heavier, or duration will be changed, or the cycle length will be changed. Some menopausal females will be having skipped cycles. Sometimes we say it is as a good sign, but prolonged skipping of the cycles, we need the monitoring of the females. That is the reason we mentioned here about skipped cycles also. And they may have the heavy menstrual bleedings, that is greater than 80 ml per day. And usually bleeding may stay more than 7 days, or sometimes the interval between 21, usually interval is around 28 days. That can be less than 21, which is abnormal. Or sometimes they may have spottings, or in between bleeding, in between cycles, they may have some bleedings, and they may have the bleeding after sexual intercourse. So when it comes to vasomotor symptoms, there can be recurrent transient episodes of the flushings, that's like warmth feeling in the skin. And usually this may be present in 75% of the perimenopausal women. And this might be triggered with the core body temperature, which can be depending upon the outside atmosphere. So hot flashes, usually it can be, this is just an illustration of the hot flashes. It can range from the increase in the body temperature, and sometimes there will be redness in the upper bodies, and there will be increase in temperature along with the sweating, and they may have shivering along with the increase in temperature, just like fever with chills in viral fevers. So when it comes to vaginal symptoms, it may vary from vaginal dryness to the itching, as we discussed earlier, and the difficulty in intercourse. But usually this is estimated in 10 to 40% of the postmenopausal women. And unlike vasomotor symptoms, usually after the occurrence of the menopause, maybe after 4 to 5 years, they may have the little relief. But here, this vaginal symptoms will be ongoing process. It will be like typically progressive in nature. So this is a picture which is showing the typical atrophic changes with low estrogen in the postmenopausal state. The epithelium is almost, the layer of epithelium is not present. And when it comes to the sexual health, usually declines as the age increases. Usually it is, the peak will be attained in the midlife, that is 45 to 64, and the lowest will be there in the 60, from the 65 onwards. And this is all because of the decreased estrogens, which causes significant changes in the vaginal epithelium. As the prior picture explains, there will be decrease in vaginal lubrications and elasticities, and decrease in testosterone levels, which are expected in the menopausal age, are also one of the causes for this. And the other most important complaint, usually all the females complain, is because of sleep disturbances. Lots of women come to the OP and they say, "Doctor, I'm not getting sleep," and all. This also usually starts in peri and postmenopausal ages. And this is not only associated with increasing age and decreasing estrogens, which are the estrogen receptors in the brain, but this is also because of other complications which are being associated with the menopause, like general aging factors. They might be having that nocturnal urinations, or sometimes they may have apneas because of other diseases, or chronic pains because of other diseases. As the age increases, some or other problems the woman might be facing, maybe because it is correlated with that also. And sometimes the stress which is being increasing as the age, maybe because of the responsibilities and the negative moods. All as usual, as we discussed, hormonal disturbances. And this hot flashes usually in the postmenopausal age, when we get it, usually it is more in the first half of the night, and the second half, due to the some suppresses the thermoregulations, thus hot flashes also decreases. But usually this is all depends upon the day-to-day lifestyle, whatever they are maintaining, that all depend. Hot flashes and sleep disturbances depends upon their day-to-day activities also. And cognitive changes, as we discussed, there can be a memory loss kind of thing. The people usually, they'll be so upset, they'll lose control in themselves, they'll be very irritable. They can have more fatigue, and mood swings will be really more in the, which usually starts from mid-age of the woman. So other most common is also the disorders. Disorder is a mood disorders. They usually have this kind of mood disorders as they reach this perimenopausal age itself. But this is usually being aggravated if already the woman is having premenstrual syndrome disorders, if they are really having more, or any stress which is being predisposing, any sexual dysfunctions which are deranging their life, quality of life. Physical inactivity, sedentary life is becoming is a major cause for this, as well as the other hot flashes which is being causing the depressive mode for them. This all aggravates the mood disorders. So urinary symptoms, as we discussed earlier, it is present in more than 50% of the women with urinary incontinences, and this is usually being associated with overactive bladder, and is usually increases with the increasing in age. So the most important thing why we usually think about menopause is like the bone health. It is very important for all the females to maintain the bone health. There is a typical norm that after 30 years, there will be decrease in 0.01% of the bone densities because of decrease of the estrogen receptors, which is very important for absorption of the calcium and vitamin D. And there is also an increase in osteocalcin and alkaline phosphatase, which also decreases the bone mass densities. So this is the reason when the woman reaches the perimenopausal and menopausal age, they complain of bone pains, and there is an increased risk of the fractures. So as we know, we kept a slide of osteoporosis to know the awareness, because we should know what is the density and how to measure it and how to take care of it. So this is nothing but a compromised bone strength. The quality and the strength and the density of the bone will be decreased. And as the age increases, more than 50, as the age of more than 50 is increasing, the osteoporosis usually starts at the hip joint. It is the first joint where usually we see it. And the score which we usually measure this bone mass density is like T-score. We usually use the T-scores. And T-scores, it is less than or equal to 2.5 is an alarming sign for us. So what are the risk factors? Well, who are the women usually get more osteoporosis kind of things? See, age factor, as we discussed, because of estrogen, lack of estrogen, 50 to 90. Any parental history of fragile bones. If the woman is having any habits like say addictions like smoking, alcohol, or prolonged usage of any steroid usages for any other problems, or already bones are being predisposed or compromised with rheumatoid arthritis, or any other secondary osteoporotic diseases. So this kind of women will be more prone, which is they are the persons who has to be very, very alert. And there is an increased risk in cardiovascular diseases also because of this menopausal age. And see, generally, women are cardioprotective because of the estrogens. But when the age increases greater than 65, there is a risk of cardiovascular diseases. But even we see this in the middle ages from 35 to 54, because this is secondary to the obesity, sedentary life, diabetes, or hypertension, or maybe the incidences which can be increased by the gestational diabetes or pregnancy-induced hypertension, general lifestyle changes, or the stress. So these are the parameters which we usually measure to protect the to measure how good your cardiac status is. And the second, and this is not, I'm just putting a slide about cancer, which not we go into the panic situation or something, but yeah, we have to mention this because as the age increases, the cancer's incidence has also been increased. So this has become the second leading cause of the death in the woman. So screening has to be started. So after 50 years of age, definitely we need to start screening. So in part of the screenings, there are mammograms, which has to be done. Every mammograms is nothing but the X-ray of the breast, so that to diagnose any lesions in the breast, we have to do it every 2 years. And colorectal cancers, maybe colonoscopies or variant enemas. There are lots of techniques to do it with once in 5 years or once in 10 years, depending upon the technology. And endometrial cancers, if any postmenopausal woman comes with this spotting or any bleeding, which should not occur in the postmenopausal woman, then it is an alarming sign. We have to go for an ultrasound to measure the endometrial thickness. Ovarian cancers, if any patient complains of any pelvic pain, bloating, which is like increase in size, any swell, any mass which is palpable in the abdomen, it's better to screen them with ultrasounds. So as we know the importance of the pap smear, it has to be done consecutively every year, at least for 3 years, followed by every third year, consecutively for every third year. And if all this are normal, once in 5 years is more than enough for the screening of the pap smears. So a quick review about how to diagnose the menopause, because we just kept in negative points, what all we should not do when we are diagnosing a menopausal age. This slide is just on definitions, which we already discussed. When the woman falls into these definitions, yes, we need to go further. And we have to take into other things into considerations, like the following investigation should not be done for the woman aged over 45 years, because definitely they shows the false positives or false negatives, that is AMH inhibins, estradiol, follicular count. These are not the investigations to measure to know whether the woman has attained menopause or not. And we should not use FHS, the diagnostic test, usually the most common test we usually use to diagnose the menopause, should not be used when the woman is on contraceptive pills like combined estrogen or progesterone therapies or high dose progesterones. And we should consider FSH in the woman for 40-45 years to normal menstrual, whoever is having a history of amenorrhea, or women who are under 40 years to know the mature ovarian failure. So when it comes to the management, I always say to my women, see, 50% of the treatment usually lies in your hands to manage the menopause. So 50% we are there to help you, but 50% has to be done from your side. There is nothing but exercises and have to have the diet properly. So lifestyle management is an important treatment plan for the menopause. The physical activities has to be good. They have to target exercises. They have to avoid addictions like alcohol and tobaccos. And stress reducing strategies has to be maintained. Meditation always helps. They have to get engaged with lots of hobbies, whatever their favorite hobbies are there. They have to resume their favorite hobbies. They have to develop the emotional stabilities. Positive attitude has to be developed, and family support is always important for them. Sufficient sleep is part of it. And we all know the benefits of the exercises. So exclusively, if we talk about menopause, it definitely helps increases bone densities, and there will be a muscle strength and joint mobility will be there. It decreases the lipids and cholesterol, triglycerides will be under control, and cardiovascular risk will be significantly decreased. And because of increase in circulations and the tiredness, the sleep patterns will also get increased, and the quality of life will be definitely benefited. And Indian Menopause Society has recommended few things how to do and exercises. I always feel like this is very important slide for all the women. 30 minutes of moderate intensity physical activity, mostly 5 days a week, is usually enough to control all the hormones or to control the symptoms of the menopause. Definitely depends upon the severity. The mild symptoms can be controlled. And muscle strengthening activities has to be done, like weightlifting. Little weightliftings has to, muscle strengthening is nothing but little bit weightliftings has to be done for at least 2 days per week. And for fitness and reduction of any chronic diseases, 30 minutes per day is more than enough. And prevention of weight gain, 60 minutes is 1 hour per day, 1.5 hours to reduce the weight. So the most important next question is like, doctor, what are the diet I have to avoid? What are the things I have to take in? So what are the food which are rich in estrogens? So that can be taken, that is like phytoestrogens will be present in lentils and kidney beans, Bengal grams and soya beans. And always we need to balance all the diet. Not only this has to be taken, it has to be a balance between all proteins and high proteins and less carbohydrates. And at least they should have the snacks of all dry fruits, which includes dates, figs, apricots, and the seedless pumpkins and sunflowers. They little consists of phytoestrogens. And these are the standard recommendations as per Indian Menopause Society. The most important thing is hydrate yourself and take food which is rich in phytoestrogens. Flax seeds, cinnamon, these are really good, and fenugreek, which are easily available nowadays, and the curd, rich in calcium. So we should concentrate. Tea and coffees has to be avoided. It's not like we should, addiction should not be there. The quantity has to be limited. Maybe we should consume milk products more. Vitamin C rich food and fruits and vegetables has to be taken. And according to the recommendations, calcium is calcium 800 to 1200 milligrams, depending upon body mass index, we can give it. And upper limit, it should not cross 2500, and vitamin D per day 1500 to 2000. So when it comes to the management, we know the menopause protocols. It is a very extensive topic. Each and every drug has its own importance and risk. We usually give depending upon the benefits and risk ratios, and depending upon presence of uterus and non-presence of uterus. The decision making will be depending upon the condition, general condition of the woman, general high risk, like whoever falling into the high risk criteria, we have to exclude those, and if the woman is having uterus or not. So we are not going much into the details of each and every drug. The brief explanation was given here. Estrogens, depending upon the presence of the uterus and the age, taking the considerations into the age, we can choose estrogen as well as estrogen plus progesterones. And depending upon the high risk criteria like cardiovascular diseases, venous thromboembolic embolic histories, or any other cardiovascular diseases, those patients, I mean chronic diabetic, chronic hypertension, those patients we need to choose. We need to choose other sources rather than oral treatments, so that we have lots of options. Like nowadays we are having gels are available, creams are available, and rings are available, transdermal patches are available. So rather than oral, whoever are falling into the high risk criteria, we can go for non-oral routes. So other non-oral routes, and the anti-osteoporotic, this is like bone density. See, definitely the densities will be decreased if there is a prolonged usage of the progesterones. So we should not add it up to the menopausal symptoms. So we have to think about the bone mass density. We need to check it, and depending upon that, we need to fix the doses. So we all know, and there is an non-hormonal therapy option also, which is we are not having any drug in it like estrogen or progesterone, that is estrogen G. We'll go into the details for that. So maybe hormonal therapies, as we just discussed, these are the doses. We have conjugated equine estrogens, which are available in very ultra low doses also, which are very safe. We can use it for the prolonged uses. And non-hormonal therapies, as we discussed, there are transdermal patches. The dose is also being tapered, and we can properly utilize depending upon the symptoms. So we have Tibolon also. We know about it. 2.5 milligrams can be used daily. This is more and it has androgenic effects who have mood swings, libidos. This is a choice of the drug. And any contraindication and specific indications was like any history of endometriosis, fibroid, and estrogen dependent. If any estrogen causing complication problems were there, then we can choose this Tibolon. And there are other non-hormonal treatments which gives relief to the menopausal symptoms, is like gamma-pentins, these are the prescription doses which we usually give in our OPs. And other prescription writing for premature menopauses is like the first choice will be E+P, that is estrogen and progesterone hormones, and low-dose oral contraceptive pills. And menopause, usually it is contraindicated. See, maybe for sexual dysfunctions, as we discussed, increases libido, that is Tibolon. And the local causes like vaginal dryness and itching, which causes dyspareunia pain, there we can go for vaginal estriol succinate. Vaginal conjugated equine estrogen is also, it helps in urogenital atrophies. And when it pertains to the urogenital symptoms, there are other options like oral tablets. Vaginal estrogen succinates creams can be used, oral tablets can be used. And these are lactic acid washes can be helpful for them to maintain the pH of the vaginas. And there are lots of vaginal preparations like primarinevilon, estriol, estradiols. And these are the selective estrogen receptor modulators. Should not be the first choice of the treatment for the for this menopause. But yes, we can consider if any strong indications were there. And these are the simple tips what we can use for the hormonal therapies. If it is hysterectomy, already post-hysterectomy patient with any high-risk complications and with exclusively mood swings and libidos, we can go for Tibolon. Perimenopausal women, always the choice is cyclical progesterones or ocipils. Early menopausal, mostly we need to go for estrogens. Late menopause, lowest estrogens so that it won't have complications. Breast cancers or more if we give excess doses of estrogens. Post-menopause with lowered libido, as we discussed already, Tibolon. Premenstrual menopause, OCPs and hormonal therapies. Urogenital atrophies, always local estrogens does the magic. So other tips is like women aged, this is depending upon the age. Women aged less than 50, they have usually we can go for HRTs, but we have to overweight the risk. Women aged in between 50 to 60, we have to see if it is greater than 60 years of age. Benefits of HRT were equal to the risk, so better to reduce the hormonal therapies, and the more complications do occur. And women aged greater than 70, we have to see the benefits, better to avoid the HRTs. So we know the problems with hormonal replacement therapies, like the risk of endometrial cancers because of excess estrogens causes this endometrial cancers, breast cancers, venous thromboembolic diseases. Triglycerides will be increased. There is an increase in the chances of gallbladder stones, and they may have the withdrawal bleedings. They may not have complete vein-off. Sequential bleedings also do occur. So taking all these things, even the Cochrane findings were there. We know that there are soya, we have discussed phytoestrogens, black cohosh. There are studies, but as such, there is no proven thing that it is sufficient to wean off all the menopausal symptoms. So this is a study where soy isoflavones were used for prevention of the bone loss in the menopausal age. And this study has shown they have given almost 200 milligrams of isoflavones almost for 2 years, but they could compare with the placebos for the bone density decrease. There is no much change. There is no much decrease in the bone density loss. So what next? It's ideal menopausal solutions. We should know it should be like it has to be estrogen protective and the symptoms has to be relieved. So this is an upregulation of non-reproductive organs, whatever the it's non-reproductive organs, the benefits has to be there, upregulation of the benefits to relieve the symptoms, and downregulation of the all breast cancers, endometrial cancers, the complications indirectly. So the next best thing nowadays, which is being available in the market, maybe we have to choose for the people who are not fit for HRTs, as we discussed, in between 50 to 60 years, 60 to more than 70 years, and post-operative cases. So we can directly go for this. This is a natural product which has an artificial estrogen effects in our body with very least side effects. So this is an estrogen G100, which regulates the vasoepitheliums and brain and bone densities also. And they have there is no proliferation of the MCF7 cells, so the risk of the cancers are being decreased. So there is estrogen 100. It also has a non-estrogenic hormone and regulator, so which gives an positive effects towards the vasomotor symptoms and decrease the symptoms, decrease the menopausal symptoms. And there are supporting studies to prove that whatever the cinnamonic acid, whatever this are going to give us a good benefits. There are 3 randomized studies which are being done, one in USA and one in Korea, which is even published in renowned journals, and they all proven that there is a significant decrease in symptoms of vaginal dryness, hot flashes, mood swings, and bone pain within 7 to 14 days. And this is being measured with Cooperman index symptoms also. And there is an evaluation of efficacy and safety of this and estrogen G on the menopausal symptoms. 12 weeks course was being given along with the double-blind placebo-controlled study, where there is a significant decrease in the osteocalcin and alkaline phosphatase, which is being measured. And they have proven there is an increase in the bone mineral densities and a decrease in the osteocalcins. So this is also one more study, evaluation of effectiveness and safety of estrogen 100 on perimenopausal women for 1 year. And the treatment group was treated for 12 months with oral administration of 2 capsules twice a day. The bone density and the serum bone markers, weight and the BMIs and serum lipids and growth hormones, FSH and estradiol were measured. And the final analysis, they have the benefit of climacterics and reduce in climacteric symptoms and femur neck bone mass density. This is all being measured, which show the significant increase. So the improvement was clearly seen in the box. And the results and conclusions were like, if we give for 12 weeks, there is a significantly improving the quality of life. And the other symptoms like hot flashes, night sweats, vaginal dryness are being significantly improved. So this may not be the treatment for all the women who are having that menopausal symptoms or this thing, depending upon the need, depending upon the severity of the symptoms where the woman faces, we can choose. But definitely this isn't the choice for the post-operative cases and who are contraindicated for all the hormonal replacement therapies, and high risk women who are even obesity, even cardiovascular diseases, even who are having the histories, even the family histories of VTs also, we usually be in a very conscious stage to start the hormonal replacement therapies. Definitely, I think this is going to replace that. So this, as we discussed, this is also an ideal for post-surgery cases. This is also one more study where the estrogen G100 has been shown good results, and there were no toxicities being proved with this. So as usual, growing old is natural, but feeling good is not. So it's just the number. Hope we all will cope up with the menopausal symptoms in the future. Hope so estrogen 100 is going to help us. Thank you so much for giving this opportunity for the Shield. It's pleasure meeting you all. Thank you.
Thank you, ma'am. Thank you very much. It was a nice data and a nice presentation. Thank you very much for your time and the support, of course. We'll see any questions are there. I will read out those questions to you, and then we will take it ahead. Ma'am, meanwhile, it has always been noticed in Indian women that they never come forward and discuss about menopausal issues and symptoms. Ma'am,
Yes.
how best we can tackle this issue, and as a pharma, what can we do regarding that?
Definitely nowadays the awareness had been increased, Prachi, but still it has to reach the woman. They always feel that something abnormalities are going in their body, but they won't appreciate. They won't accept it. That is because of hormonal changes.
Yes.
See, we see lots of families come to me. They all come together. They say, my mother is so restless. My mother is sweating a lot. My mother is sweating a lot in the sense that she's not coming out for investigations or something. Usually the complaints come from the other family members.
Yes.
So it's better to the other generation has to concentrate on the elders and try to educate them, try to pull them to the doctors to just to have an checkups. Not just only thing is the 50%, as we discussed, it's only the lifestyle changes. If we do lifestyle changes, the 50% of the menopausal symptoms will be handled very easily. But
Right.
a few women can't cope up. They definitely need a teamwork. Sometimes they need a teamwork of the gynecologist as well as the psychiatrist also. But yeah, yes, some almost 80% can be handled only with the gynecologist. But we should not go to a certain extent. Everything is out of our hands. So this education is always lagging. Hope so. This kind of sessions will be helpful for the women if they really listen to us. They definitely have good information about the menopause and when to reach the doctors.
Right, ma'am. Ma'am, few of our sales colleagues are also meeting doctors, and they are requesting that proactively doctors should start asking questions, especially in those kind of women.
Yes.
Is this approach appropriate, and your opinion?
Very true. When any woman who crosses 40 or 45, maybe we should start in OP itself. Definitely, this is a very good point which is being raised. Um, Generally, we won't target to the only one complication. The general simple history, whatever we take, it covers everything. So, but proactively, we can't go and check whether they are having this hot flashes or whether they are having, maybe every woman who comes to our table, maybe 40, 45 years, irrespective of anything, irrespective of all the complaints, yes, we should start taking the history, we should start asking them, and we should encourage them to approach us if they have anything. Definitely this point will be noted, and definitely it is helpful. And usually above 40, some or other women will be coming to us with the irregular menstrual cycles,
Right.
not all,
Right.
but yeah, whoever is having, definitely we usually counsel them for all these things.
Yes, ma'am. Ma'am, so do you recommend treatment, some sort of treatment and lifestyle management with this perimenopausal symptoms, of course?
Exercises. See, the conversion of, we discussed a point there. See, the peripheral aromatizations is nothing but the changes which we usually occurs in the fat. So once we do exercises and sweat a bit, that aromatizations, we ourselves, we are increasing and we are converting our fat to the estrogens. So I always say my patients in their own language, your fat consists of your required hormones. Why can't you convert them into the required hormones? So it's always better to do exercises, reduce stress. See, definitely the stress is there for all the women in their life. That has to be cope up. That has to be cope up with doing medications, engaging themselves with their favorite works, and doing exercises for at least 30 to 40 minutes per day for 5 days is always recommended for everybody.
Right, ma'am. At least 20 to 25 minutes per day is also sufficient. That's what we also say in
Yes.
PCOS. Correct.
Prachi is pampering yourself, Prachi.
Okay. But thank you very much. I mean, these were the questions. Basically, there are many comments that the talk was good and good information. So many comments we have received. We will send it across to you. So thank you very
Yes.
much.
Thank you so much. Thank you so much, Prachi. Nice meeting you all. Bye.
Thank you again.
Thank you.
Thank you, madam.
Thank you.
Thank you.